Hi, my name is Isaac Hernandez, Program Director for the UTHealth McGovern Medical School SCI Fellowship. Thanks for your interest in us. My goal today is to tell you all the basics you need to know about our program. And first and foremost, welcome to Texas, the land of everything big. And for Exhibit A, welcome to our home, the Texas Medical Center, the biggest medical center in the world. How many medical centers have their own skyline? Very quick. I will be touching on the team, the program, clinical sites, educational opportunities, program updates, and a few other random things. So first of all, the team. We're headed by our fearless leader, Dr. Francisco, chair and renowned spasticity expert, Dr. Frontera, vice chair of education, former residency program director, and current SCI faculty, and myself. Additionally, we have Dr. Davis, our SCI Service Line Director at Tier and former SCI Program Director, now an Associate Program Director. And the one that makes everything happen and that you probably already know, or likely will soon, Kathy Brown, our Program Coordinator. These are all of the additional docs that are part of our program. All SCI doctors, all SCI certified. That's a total of 11 spinal cord injury doctors here to share with you their knowledge and passion for the field. This slide is pretty self-explanatory. We are a one-year program, ACGME accredited, and we use the match. These are the 4 main training sites, including a freestanding rehab facility, the largest level trauma center in the country, our outpatient building, and the Houston VA Medical Center. To talk a little bit more about the clinical sites, this is where consults are done. There is a wide variety of cases, including dual diagnosis, vent patients, chronic SCI patients with ITB pumps, etc. Tier Memorial Hermann. This is our home base. In addition to having the ability to work on the bread and butter SCI issues regularly encountered, we care for 30 to 40 vent patients per year as of 2021, as you can see here. This is a distinguishing factor in that PM&R manages the ventilator patients. Also, we see 1 to 2 cases of pacers/stimulators on most years. Regarding the outpatient tier services, included here all the different outpatient opportunities for fellows. I would like to highlight the ability to do over 30 injections per month during the clinic rotation, including ultrasound-guided phenol injections with our SCI-trained spasticity expert, Dr. Radha Korupulu. The CMI for the service line is actually higher than the CMI for the hospital as a whole. The number you see here is the one for the hospital as a whole. Ours for the SCI service line is even higher. Sample rotation schedule. You can see on the one side the current rotation schedule. On the other, a proposal we're currently exploring its feasibility for. The flexible months would allow the opportunity to participate in one of the courses I will mention shortly, do more research, spend more time in clinical settings or doing procedures, spend more time on inpatients, spend more time at one facility versus the other. Again, flexibility. No specific counts are required. There's plenty of opportunity to do these injections. Many of our graduates have done this and felt comfortably and ready to manage after graduation independently. As it relates to educational opportunities, we have all these different options. There are regular didactic activities dedicated to the fellow, usually with 1 or 2 fellows and plenty of faculty available to them. This includes different setups that can include journal club setting, case presentation settings. In addition to this, when at Tier, there are weekly lectures for faculty and trainees on Monday at noon, etc. And I would also like to highlight the teaching opportunities available, including the possibility to be part of the BCM annual review course, which is a national platform. There are these 2 courses available through UT McGovern Medical School that are protected if so desired. If you have an interest in quality improvement, you can attend this kind of meetings that can show a behind-the-scenes glimpse of hospital quality and administration. And I believe this slide is pretty self-explanatory in terms of resources and perks available. In terms of research opportunities, There are plenty of them. We often are able to provide our fellows early on in fellowship with opportunities to jump into an ongoing research study or to guide and provide mentorship for any projects that fellows may have themselves. We have Dr. Koropoulos and Dr. Stampas, who are clinical researchers and are part of our SCI faculty to provide a lot of this guidance, but it is not exclusive. Other faculty members, plenty of them, are involved in different research opportunities as well. In terms of recent program updates, I am your new program director. Dr. Davis is your new associate program director. And as discussed before, we're working on making some adjustments on didactics and our rotation schedule. Here's a quick glimpse at our recent graduates and their current activities. I definitely would like to highlight that there are no call responsibilities and that there is a 100% board pass rate. In light of COVID times and virtual interviews, please check out our facility at this link so you can get a sense for what tier looks like. Finally, we look forward to hearing from you. Houston is a great city, and we pride ourselves in our department's sense of community. Thank you for your interest.